badass doctors. Today we have a 66-year-old woman coming in for a routine physical examination. She volunteers that her menopause occurred at age 51. Her medical history is unremarkable, and her family history includes one maternal cousin with ovarian cancer. Her vitals include a blood pressure of 120/70, heart rate of 70, and temperature of 98 degrees. 98 degrees. Oh, I digressed. Okay, back to the case. Her weight is 140 pounds and her height is 5'4". The thyroid is normal to palpation. Breast examination reveals no masses or discharge. Abdominal, cardiac, and lung evaluations are within normal limits. Pelvic examination shows a normal multiparous cervix, a normal-sized uterus, and no adnexal masses. She had undergone a mammogram 3 months ago. Great, that's off the checklist. The patient states that she has regular pap smears and that the last one performed 1 year ago was normal. Our next step is to figure out our clinical approach. So, aside from episodic care to treat acute or chronic illnesses, a major part of medical practice includes preventative care, and that is medical care to prevent diseases or to detect it early enough that interventions are more likely to be effective. So, let's break it down into immunizations, behavioral counseling, chemoprevention, and screening.
This one over here has decided to make herself a DIY doggy door.
So immunizations are basically your vaccines. Behavioral counseling regards regular exercise, avoiding or quitting smoking, tobacco, moderate use of alcohol, and screening for depression. Chemoprevention is like, for example, if you have a patient who's pregnant, you want to give them folate to prevent any neural tube defects, or you would give a low-dose aspirin to prevent cardiovascular events. For screening, we've got identification of disease or risk factors in an asymptomatic patient. Follow me onto my phone and I'll show you what are my 2 favorite apps that I like to use for these wellness annual visits. All right. I recommend every doctor downloading these 2 apps right here. One is the USPSTF, United States Preventive Services Task Force, and the other one is the Vaccine Schedules by CDC. All right, let's start off with the USPSTF. So our patient is 66 years old. She weighs 140 pounds. She's 5'4". She's 66, so I doubt she's going to be pregnant, so I'll say no here. Don't know if she's a tobacco user, and I don't know if she's sexually active. If she is, go granny.
He's undressing me with his eyes.
Do you want to move to another table?
Not yet, he's only half done.
Do you realize it has been 4 days since I have enjoyed the company of a man?
All right, let's press start. All right, so there are these different grade categories. A and B are basically the ones that we would recommend for you to screen for these services. C is, I'll see what the patient thinks. This is definitely between the doctor's professional decision making and the patient's preference. D stands for, don't do it. The USPSTF recommends against the service. I stands for insufficient current evidence to run that service. So going back to our patient who's a 66-year-old female, it's important to know what are the most common causes of mortality in those ages 65 or older. The main 3 are cardiovascular disease, cancer, and infectious diseases. So under cardiovascular disease, we would be looking for hypertension in all patients by checking their blood. And since our patient's blood pressure is at 120/70, it doesn't look like she has hypertension today. Since our patient is at the age of 66, any females at the age of over 45 with no risk factors would need to get their lipid panel checked anyways. So we would run that to check for hyperlipidemia. If she has any other comorbidities such as hypertension or hyperlipidemia, we would screen for
diabetes
every 3 years. Or we would also screen for diabetes if her BMI was greater than 25, and it is at a 24. So we would run it if we knew if she had hypertension or hyperlipidemia. For cancer, we would check for breast cancer by running a mammography. And since she said that she had her mammogram done 3 months ago, that's great. We got to see what that result came back as. To check for cervical cancer, she has officially graduated from Pap smears. So Pap smears, also known as cervical cytology, should be deferred until age 21. And this is due to the fact that adolescents many times will clear the HPV infection and cause an abnormal Pap smear to normalize. The Advisory Committee on Immunization Practices recommends that the HPV vaccine should be recommended to both males and females between the age of 9 and 26. For the ages of 21 to 29, they can get a Pap smear every 3 years. And then once they're 30 to 65, they would get a Pap smear every 3 years or get a Pap smear with an HPV co-testing every 5 years. For our patient, cervical cancer screening can be stopped at age 65 if all previous Pap smears have been normal.
Because back when I was your age, I always used to make myself a big banana split after sex. I think you're going to need one tonight.
Oh, don't get ahead of yourself, Magda. You'll probably be eating a banana split before I do.
Don't bet on it. Last time I had a Pap smear, the guy needed leather gloves and an oyster shucker.
For colon cancer, she's got 3 options. She could either do a FIT test, which is a fecal immunochemical test. It's basically the same as the fecal occult blood test, and that's just to check for any blood found in your stool annually. Now, if that comes back as positive, she would need to go in for a colonoscopy. The other option is to either get a flexible sigmoidoscopy every 5 years or just to get a colonoscopy every 10 years. For lung cancer, the USPSTF recommends annual screening with low-dose CT in adults ages 55 to 80 who have a 30-pack-year smoking history and currently smokes or have quit within the last 15 years. For infectious diseases, it really depends on the lifestyle of our patient. Are they monogamous and happily married, or are they single and ready to mingle? Depending on that, we are going to screen for certain STIs depending on high-risk behaviors. It's important for all men and women starting at the age of 65 to get screened for osteoporosis by getting a DEXA scan to look for bone mass density. Having a low bone mass density indicates a higher risk for fractures, and this is also a time when a lot of geriatric patients tend to fall.
What in the hell was that all about?
So this is also a great time to work on fall prevention by giving exercises that include strength training, weight-bearing aerobic activities such as walking, dancing, low-impact aerobics, elliptical machines, stair climbing, and gardening.
Hi, I'm Greg Anderson, your host for the Brown Thumb Gardener. If you can take a plant like this and in a few short weeks turn it into something more like this, you may be one of us. Or if you just hate your neighbor because everything they touch turns green, you must be one of us. Now, as brown thumb gardeners, we're gonna forget about the chemicals. We're gonna forget about the books. We're gonna stick to the basics. Why? Well, as much as all of us love a picture-perfect yard and garden, who has the time? Who has the energy? There's other things we like to do, like fishing. Got one. Or maybe do just nothing at all.
All right, let's go ahead and check out that second app. It's the vaccine schedules according to the CDC. This is the Centers for Disease Control and Prevention. Now, I am neither a pro-vaxxer or an anti-vaxxer. I'm pro-choice. I think it's so important for doctors to have that conversation with their patient about whether or not they want to get this recommended vaccine. Now, it's important to weigh out the pros and cons and then have that discussion so that the patient can decide whether or not they are likely to be seeing their grandchild, for instance, or if they're working in an area where they are going to come into contact with certain diseases, and it is highly recommended to get the vaccine, but it's up to them on whether or not they want to get it. But it's good to talk about that with your patient. So anyways, let's go ahead and check out this app. All right, our patient is 66 years old, so she's an adult. Let's hit adult. All right, you'll notice here that there are different age categories. There's 19 through 26, 27 through 49, 50 through 64, and 65 and older. So since our patient is 66, this is what we're going to look at. Now, there are different colored boxes here. If you don't remember, the way I like to remember is yellow is the gold standard. And if you don't quite remember what the other colors represent, there's a key up here in the right-hand side corner. And it'll tell you that yellow means the recommended vaccines for those who meet the age requirement, lack documentation of the vaccine, or lack evidence of past infection. Purple means the recommended vaccines if there's an additional risk factor or another indication. Blue means it's recommended vaccine based on shared clinical decision making. And white means there's no recommendation or it's not applicable. All right, so for a 66-year-old patient, we are going to recommend getting a flu vaccine annually. If you don't remember what this represents, you can click on it and it'll tell you. And I think this is important to get just because over 90% of influenza-related deaths occurred in patients over age 60. Next is to find out when she last got her tetanus booster, because it's important to get that every 10 years. Next one is the zoster vaccine, getting 2 doses of that. It has been shown to greatly reduce the incidence of herpes zosters, which is shingles, and the severity and likelihood of post-herpetic neuralgia. And then the other one is the pneumococcal vaccine, getting 1 dose of that. Hey guys, I forgot to mention this third app that's really great for evaluating cardiovascular risk. It's the atherosclerotic cardiovascular disease risk calculator. So let's go ahead and click on it. All right, so based on her case, we know her age, her sex, we don't know her race. We know her systolic was 120, her diastolic was 70. We don't have her cholesterol levels because we don't have her lipid panel. And we don't know if she has a history of diabetes or a history of smoking or hypertension. We don't know if she uses a statin drug or an aspirin drug. And what's nice about this is you can refine current risk estimation based on the data. And here on the bottom, it'll tell you that the 10-year risk for atherosclerotic cardiovascular disease is categorized as low risk is less than 5%, borderline risk is 5 to 7.4%, intermediate risk is 7.5 to 19.9%, and anything greater than 20% is considered a high risk. Hey my badass doctors, let's wrap up this case of the 66-year-old female coming in for a routine physical examination. So under her treatment plan, we're going to do 4 different things. Under immunizations, we're going to recommend her getting the flu vaccine, her tetanus booster, herpes zoster vaccine, and the pneumococcal vaccine. For 2, under behavioral counseling, we are going to ask her to stop smoking if she is a smoker, Work on fall prevention to prevent any future fractures with exercises to work on balance and stability and to maintain bone mass density. We would also screen for depression using the PHQ-2, and this is the Patient Health Questionnaire 2. And if that's positive for depression, then we would follow that up with the PHQ-9, or specifically, since she's over the age of 65, the Geriatric Depression Scale. And as a naturopathic physician, I would also like to ask about her foundations of health, consisting of sleep. What is her quality of sleep? Is she having a hard time falling asleep and staying asleep? 2, what's her diet like? Is she getting a well-rounded diet? Is she eating the colors of the rainbow? 3, movement and exercise. What does she like to do to stay active all day? 4, sunlight. So is she going outside? Is she getting enough vitamin D? 5, social life and relationships. What does she like to do for fun? Does she have a happy relationship with her family members and friends? What's her love life like? 6, does she have any spiritual rituals? It could be as simply as going to church, or it could be doing your own thing for yourself. It could be something like doing yoga. It could be doing something as enjoying a green space out in the woods every Sunday morning. Whatever that looks like for you, that's what I would discuss with the patient. 3, chemo prevention. We could consider statin use as a preventative measure for all adults ages 40 through 75 with no history of cardiovascular disease, one or more cardiovascular disease risk factors such as dyslipidemia, diabetes, hypertension, or smoking, and a calculated 10-year cardiovascular disease event risk of 10% or greater. And according to the USPSTF, we would screen for hypertension, hyperlipidemia, and diabetes. Under cancer, we would check for breast, cervical, colon, and lung cancer. Infectious diseases, based on her high-risk factors, we would check for any STIs. And according to her age being over the age of 65, we would look for osteoporosis. All right, doctors, this is Dr. Sola signing off. I'll see you next time. Mwah.
Diabetes.